for you. Okay, then what you're going to do is you're going to take the soapy end, clean up over the top, down the side, and up underneath yourself. And when you're finished with that, you're going to use all the very same motions with this, with the rinsing end. And then the middle we've kept dry, and then you're just going to pat dry. If this were a female patient, the thing that you would do differently is this. You would go ahead and wet both ends, as you did before, soap up one end, and then you'd start on one side, taking one swipe down, one motion, being very careful that when you get ready to take the next one, you use a different part of your towel. Down the center, again repeat using a different part, and then do the other side. It's very important to use a different part of the towel each time, or else you may introduce infection. Go to the other end to rinse, and you're going to repeat the very same thing. Swipe down one side, different part of the towel, swipe down the center, another part, swipe on the other side. Take your dry area in the middle of the towel and pat dry.
On some days, the bath will be followed by washing the patient's hair, but hair doesn't need to be shampooed every day unless it's very oily or uncomfortable. To give a wet shampoo, position the patient on their back with a towel under their head to protect the bed. Place the shampoo basin or inflatable sink under the patient's head. Using a pitcher, completely wet the patient's hair. Use warm water ranging from 105 to 110 degrees Fahrenheit. Massage the scalp and the back of the upper neck gently with circular motions. Check for painful areas, knots, or swelling. Now rinse using warm water from the pitcher. Blot the hair with a towel to absorb any excess water, and raise the patient to a comfortable position while you dry the hair with a towel or blow dryer. Once the hair is dry, you can style it according to the patient's preferences. If you don't have a shampoo basin or inflatable sink, you can make one. To fashion a simple device out of basic household items, you'll need a large plastic trash bag, a sheet or bath blanket, a large plastic bucket, and some towels. Roll the sheet or bath blanket into a U shape and place it in a large plastic bag. Place the bag under the patient's head with the U-shape turned on its side. The open side of the bag will drain the water into the bucket on the floor. After the bath is a good time to perform nail care, usually on a weekly basis. Apply moisturizer or oil into the cuticles. While the cuticles are softening, clean under the fingernails using the pointed end of an orange stick. Massage the softened cuticles to help loosen them. Then, using the orange stick or a cotton swab, gently push back the cuticles. Don't poke the cuticles or break the skin. Then go ahead and trim or file the fingernail along the natural curve of the nail. Be careful not to cause any cuts or abrasions that could lead to infection. Regarding foot care, always check with the physician before working on a patient who has diabetes or poor circulation to the legs. A professional should provide foot care in this instance or teach you how to do it. When you're finished with all the patient's hygiene care, remove soiled linens and other items and disinfect the bath basin with hot, sudsy water and a germicidal solution. The bedridden patient requires special care and creativity to make life as normal as possible. Look for ways to help the person maintain a sense of meaning, dignity, and independence. You may also want to consider special medical equipment and accessories to provide more comfort and support. For example, an adjustable hospital bed may be the best choice for bedridden patients, and it helps prevent back strain for caregivers. Select bedding that is lightweight, soft, and washable. Synthetic fabrics are often too hot and don't absorb perspiration. Always have several sets of bedding changes on hand to be ready for unexpected circumstances. However, a complete bed change shouldn't be necessary every day as long as you protect the bottom sheet with a disposable pad or draw sheet. If the patient is not able to get out of the bed, change the linens while the bed is still occupied. Always explain to the patient what you're going to do in advance, even if they seem unresponsive. Before you start to change the linens, make sure the bed is at a comfortable height and the rail opposite of you is raised. Lower the head and foot of the bed to a flat position, then apply plastic gloves for protection. Now remove the pillows. The patient should remain covered by a sheet for privacy and warmth. Help the patient move to the opposite side of the bed. Starting at the head of the bed, strip the bottom sheet, draw sheet, and linen-saving pad from the unoccupied side of the bed. Roll the sheet tightly against the person's back or side. Remove your gloves before touching the clean sheets. Now slip the clean fitted bottom sheet over the top and bottom corners of the mattress. Fan fold or roll the rest of the sheet next to the patient's back or side. Then place the draw sheet in the middle of the bed. Tuck the edges of the sheet tightly under the mattress. Fan fold or roll the rest of the draw sheet next to the patient. If needed, place a linen-saving pad in the center of the bed and tuck it under the patient's back or side. Now that you've completed this side of the bed change, raise the side rail. Move to the opposite side of the bed and lower the side rail. Put on another pair of gloves and loosen the soiled linens. Help the patient roll onto the clean side of the bed and remove the soiled linens. Remove your gloves once again and pull the folded bottom sheet, draw sheet, and linen-saving pad toward you. Place the fitted bottom sheet over the top and bottom corners of the mattress. Pull the draw sheet tightly toward you and tuck it under the mattress. Help the patient onto their back if necessary. Center a clean top sheet, hem side up, over the used sheet, while you pull out the used sheet at the foot of the bed. Place the blanket on top of the clean sheet. Fold the top of the sheet over the blanket. Complete the job by changing the pillowcases. After changing the linens, help the patient into a comfortable position. There are two positions a patient can use, the back-lying or supine position or a side position. If the patient needs help moving onto their side, tuck one or two pillows lengthwise under their back to provide support. The pillows are necessary to position the patient in a way that prevents muscle strain and fatigue. Place a pillow lengthwise between the patient's legs to relieve pressure on the inner legs and thighs. Next, place a pillow lengthwise under the patient's upper arm to prevent the shoulder from dropping forward onto the bed. To position the patient on their back, raise the head of the bed to a comfortable height. If the bed is not adjustable, you can purchase an adjustable backrest. Next, place a pillow lengthwise under each arm for support. If necessary, you may want to use a footboard or high-top tennis shoes to keep the patient's feet in correct alignment. Mealtime is often the highlight of the day for a bedridden person. To promote independence, encourage the patient to help select the menu. Unless the physician advises otherwise, raise the patient to a sitting position to eat. A hospital-type overbed table can be used to serve meals. You can make your own overbed table by covering a wooden board with vinyl shelf paper or wallpaper. Place a straight-backed chair on each side of the bed and lay the covered board across the chair backs. If the patient has difficulty using utensils, serve finger foods such as small sandwiches, soft vegetables, fruits, cheese, and meats. Always encourage the patient to feed themselves. If you're concerned about spills, cover the patient with a plastic cape or water-resistant gown. A straw or spill-proof cup and a plate with a non-skid mat underneath can help prevent accidents. With the bedridden patient, it's also essential to provide a regular routine. Most patients do best when they have a set time for bathing, meals, activity, and rest. It's also important to maintain natural cycles of light and dark in the patient's room. Open the curtains or blinds in the morning. The bedridden patient should, if at all possible, be placed near a window with a view. Also place a large calendar and clock in the room. Encourage or help your loved one to keep a personal calendar marking special events or activities they can look forward to. Special events and surprises are also important to break up the daily routine. These don't have to be elaborate. You can wrap up a little gift, rent a movie, or schedule a visit with a special friend or relative. You should, of course, gear activities to the person's mental capabilities. Here are some tips to ensure a successful visit whenever company drops by. Start by paying attention to the patient's hygiene and grooming before the visit. Then prepare visitors in advance with ideas for conversation and activities, like a game of cards or board games, writing a letter together, or making a video or audio tape to share with others. You can also help the bedridden patient maintain meaningful involvement with the family. Your loved one may still be able to do small chores like folding laundry or helping children with homework or other interests. As patients become more frail or ill, they may naturally withdraw. One of your responsibilities is to encourage the patient to enjoy activities and social contact. You should, however, let them set their own pace. Last, but certainly not least, find ways to cut down on your workload. Organize the patient's room to prevent unnecessary steps. Then, organize a routine that gives you some free time while the patient enjoys solitary activities. Set limits on the number of trips you'll make to get things for the patient. Then ask the patient to consolidate requests for items that aren't essential. If the patient is making numerous requests, try to find out the underlying need. You may find the patient simply wants attention or diversionary activities due to loneliness, fear, or boredom. Mobility is a significant factor in your loved one's sense of independence and self-confidence. In turn, the more mobile your loved one, the less dependent they'll be on you, giving you more time to concentrate on other activities and responsibilities. Safety is your first concern when helping someone with mobility. A nurse or physical therapist can determine if you're physically able to help the patient by yourself. If not, special devices like a mechanical lift can relieve much of the physical burden. First, let's learn how to safely transfer a patient from the bed to a chair. In each step, tell the patient what you're going to do before you do it. Position the chair or wheelchair at an angle on the patient's strongest side, then lock the wheels of the chair. Next, remove the wheelchair's footsteps. If you use a stationary chair, make sure it's heavy enough to prevent sliding as the patient sits down. If you're using a hospital bed, lower the height of the bed and lock the wheels. Slowly raise the head of the bed to a sitting position. Help the patient toward the side of the bed nearest you. Have the patient hug you with their arms over your shoulders. Now hug the patient with your arms under the shoulders and around the back. While you're still in the hugging position, help the patient sit up and slide their legs off the bed. To prevent dizziness, allow the patient to sit for a few minutes to get accustomed to this new position. Now move the patient's feet slightly apart and rest the patient's hands on your shoulders. Straddle the patient's weaker leg with your own legs. Bend your knees using a wide stance for balance. On the count of 3, straighten your knees and help your loved one rise to a standing position. On another count of 3, pivot the patient to the chair and use small shuffling steps while continuing to hug one another. If they're able to support themselves, ask the patient to place both hands on the arms of the chair for support. Make sure their hips are placed well back in the chair before lowering them to a sitting position. If the patient has difficulty sitting upright, you can use a special belt to secure the patient in the chair, or a special chair that has a table tray attached. Next, let's learn how to assist a patient who needs help with walking. Instead of transferring the patient to a chair, let them stand for a few minutes at the side of the bed with their hands on your shoulders for support. Normally, you'll walk on the patient's weaker or affected side, but if the patient tends to lean toward you, walk on their stronger side. Place your inside arm around the patient's waist, pulling them tightly toward you. The patient's arm should go around your waist, and you support the patient's hand with your outside arm. Do not allow the patient to put an arm around your shoulder, because if the patient should fall, it could pull you down too. Walk slowly, using small, even steps to match the patient's gait. An alternative method begins with you sliding your arm under the patient's arm. Firmly bring your forearm to your chest, drawing the patient to you. Hold the patient's inside hand with your outer hand. This position gives you good control of the patient. If they begin to fall, go down with them, controlling the speed and direction of the fall and paying particular attention to the patient's head. Do not try to keep the person lifted in the air using your back and arms. You may need help getting the patient up from the floor. Do not try to do this alone if the patient is not physically able to help, or if you suspect any injury to the patient.
If someone falls while they're at home, there are two things that are most important to look at. One, is there pain at the site of the fall? Is there any swelling? Before you move the individual